Welcome back. In this video, I'll talk about the symptoms and treatment of gallbladder stones. The gallbladder is a small organ just underneath the liver. The liver secretes a fluid called bile, and this fluid is secreted and concentrated within the gallbladder. Occasionally, this fluid can make some small stones. Once these small stones form, they can grow bigger, but they will never dissolve. But the gallbladder is connected to the intestine through a small tube, and this is known as the biliary tree or the CBD, the common bile duct. Keep in mind, the pancreas is also connected to the common bile duct, and the common bile duct drains into the intestine. So small stones might pass from the gallbladder into this CBD, and they can go into the intestine. But again, they do not dissolve. Sometimes a stone might pass into this CBD and get stuck at the outlet, causing increasing pressure of the common bile duct and pancreatitis as well as jaundice. So small stones can be dangerous because they can get stuck in the outlet and cause compression in the biliary tree. Larger stones will always get stuck in the gallbladder and they will never leave the gallbladder. Sometimes they can cause inflammation of the gallbladder, and this is known as acute calcular cholecystitis. And for these patients, we must perform surgery to remove the gallbladder. Unlike kidney stones, we cannot destroy or take out these small stones. We have to take the gallbladder along with the stones. In cases where you cannot perform surgery, for example, if somebody is in the ICU and they have some heart problems, and they also have acute calcular cholecystitis, we can use something called a PTC, where we simply drain the fluid within the gallbladder using a small needle through the skin. This relieves the inflammation and relieves the symptoms of pain. It basically buys the patient some time until we can perform the proper surgery. The acute calcular cholecystitis pain starts in the right upper area of the abdomen and radiates to the back. The patient might also have pain in the shoulder. There will also be nausea, vomiting, and sometimes fever. If we do some labs, we will see increasing in the liver function test with increased WBC. And if you really want to be sure, you can do some radiological testing like ultrasound or CT. Here are the risk factors for developing gallbladder stones: being overweight and living a sedentary lifestyle, and ironically losing too much weight too quickly, being pregnant, eating a high-fat diet or high-cholesterol diet or low-fibers diet, being diabetic or having sickle cell disease or sickle cell anemia or leukemia, taking medications that contain estrogen like oral contraceptive pills, and having liver diseases. And here's a small quiz. Which of the following ethnicities puts a patient at risk of having gallbladder stones? European, Asian, Mexican, or African? And the answer is Mexican. Actually, Hispanics, Mexican, and Native Americans are all at higher risk of developing gallbladder stones. That's all I have, and thank you so much for watching.